Very good evening to one and all. I am Arpita from the IGCP group, the moderator for today's session. The topic that we are going to cover today is stress and medical practice. And yes, to address this topic, we have with us someone very eminent, none other than Dr. Rajesh Dedi sir. It's an honor for me to welcome sir to our platform and to introduce him to everyone. Sir is a highly experienced consulting physician and non-intervention cardiologist based at Omkar Hospital, Rajkot. With an MD qualification, he has dedicated his career to providing exceptional care in the management of cardiovascular diseases and internal medicine. He combines his clinical practice with a patient centric approach, focusing on accurate diagnosis and evidence based treatment to improve patient outcome. It's an honor for us, sir, to have you in our platform. So, with this very brief introduction, I would now request you to please start with your topic for today. Over to you, sir.
Thanks, Arpita, for the nice introduction. And at the outset, I thank IJCP for inviting me to talk on my favorite topic. Friends, I have been talking on this subject for almost more than 2 decades. But I feel I was experiencing that the doctors are passing through tremendous stress. And now this is probably the right time to go on a larger platform to discuss what a doctor passes through this stress. So straightway I will start with my discussion. Now, how I developed this idea of presenting what is a stress of medical practice, because I got chance in last 35 years I treated almost 100 different doctors from various specialties, physicians, pediatrician, anesthetists, almost all specialties I covered as a treating doctor, and I found some common problems amongst many of us. I include myself as well. Acid peptic disease, mainly gastroesophageal reflux, backache and neck hypertension, anxiety and depression, uncommon infections, IHD, and sudden cardiac death. It was one of the eminent physician in my city who had sudden cardiac death in his own consulting chamber. And that was the incidents which excited me and made me think that it is high time to analyze why a doctor is getting this kind of problems in more and more frequencies. See, all the patients who had hypertension, they had all common features. They had no conventional risk factors, but all had hectic medical practice. We can say that practically functioning 24 by 7. And they were unaware that it was the practice itself which was a cause of that. It was important risk factor for that problem. And they felt that they were enjoying the practice because I had inquired all these patients. And I call this situation the stress of medical practice, that all of us are consciously unconscious about this factor. Somehow, either we are overconfident or we feel that the medical practice is best way to earn money, and probably that is the only focus why we are this facing this problem. See, now I realize that in our academic teaching in medical colleges, there is hardly any teaching as far as the approach to the patient, as far as the application of science is concerned. See, all the approach which when the patient comes to us, we analyze symptoms, we investigate the patient, we carry out certain procedures, maybe surgery and intervention. But one thing we must remember, that our science is not 100% perfect. We have limitations at all levels. The symptomatology has many limitations, investigations we carry out has limitation, and even the treatment part. And probably this is the time, because society and every patient is analyzing very critically whatever advice we give. And this limitation of the science is unknowingly our stress factor. We will discuss how this limitation is creating stress to our practice. I believe that a doctor should analyze the stress in his consulting room, in ICU, in operation theater, in labor room, in hospital. So let us start that when a patient comes to us, we evaluate the patient through the symptoms. So what is the dilemma? At the end of the day, many of my colleagues, even those patients who are hypertensive, were telling that I have seen these many patients, but at least 5 to 10 patients I could not come to conclusion. what was the diagnosis. And that stress is creating an unknown hidden stress lying inside the doctor's mind. So, what are these problems? One is atypical symptoms. See, nowadays it is high time that we become aware about this limitation of symptomatology and pass it on to society. I will just start with only one small example, that a patient who has got ischemic heart disease or a patient who is having myocardial infarction has only burning in the epigastrium, or he feels that it's a gas, or there is some jaw pain, or there is only elbow pain. This patient himself feels that it is gas and acidity. Now, see this part, if a clinician or a general practitioner is not aware that acidity looking symptom can be a sign of angina or myocardial infarction, it's a big problem for him, because then he will miss the diagnosis and he will have a lot of problems. So we have to understand about the asymptomatic or atypical part of the disease. Second, there are many disorders which are developing the system stepwise. Common as we talk about collagen vascular disorder, they have a slowly progression of the symptoms. So in early stage, you may not be able to clinically suspect as to what could be the cause of the disease, or many asymptomatic presentation. We don't know how it is creating stress to us, but all patients, diabetic patient, hyperlipidemic patient, hypertensive patients who are sizably asymptomatic, we have to convince them that you have to take lifelong medication in spite of you being totally asymptomatic. So all these situations we have to analyze and reach to a conclusion how to tackle them. Then our next step is the investigations. Whatever modality of investigation we are using have false positive and false negative. There, some tests may be highly specific and some tests are highly sensitive. I will again take example of an electrocardiogram. As we know that as a diagnostics tool, electrocardiogram has many limitations as far as the ischemic heart disease is concerned. Patient having triple vessel disease, at rest the ECG may be totally normal. So much so that almost 2 to 3% of the patient having acute myocardial infarction may have normal ECG. So how to understand this and how to communicate this to society or to the patient is very important. And some lacunae here or there is creating big problem, big medical legal problems, and to the reputation of doctor. So now it is high time, because we have been studying in medical colleges indications and applications. Now it is time to understand the limitation and sharing this limitation with the patient and to the society. So I will just tell you what is my approach. If a patient with unusual burning epigastrium or in the chest comes to me, and if his resting ECG is normal, I explain to them that at this stage, I cannot tell you that your problem is only acidity. It can be heart. The chances are less, but I cannot take chance. You have to remain in the observation for 4 to 6 hours. I may need to repeat your electrocardiogram, and you need to undergo certain blood tests which will tell me whether your pain is cardiac or it is acidity. See, in past it has happened that symptom looking acidity, normal ECG, patient is allowed to go home and the patient dies on way. So these are the stresses which we are facing, and we have to find. Now, these are all double-edged situation. Say out of 10 patients of hyperacidity, only 2 will have coronary. 8 will have genuinely hyperacidity or reflux. In this situation, the other side of society will tell you that I had only acidity and this doctor took 2 ECGs and blood tests and spent me 5,000-7,000 rupees and it was only gas. So you see the atypical presentation, limitation of our investigation is producing double-edged sword to us. So what approach I have made is, when I have a patient with atypical symptom, first ECG is normal, I tell them that you need to remain under observation, not necessary in my hospital, not necessary in corporate hospital. The nearest hospital you have, you remain, you may go to trust hospital or you may go to government hospital. Now, this leads to development of faith in the patient that what my doctor is guiding is for my benefit and not his benefit. So these limitations, unless we plan out the strategy, These are going to create big problem for all of us. Then the situation of complications. See, minor complications of major procedure and major complications of minor procedure. These are creating problem day in and out. And of late, we have realized that all media and everybody in society, any complications is a mistake of doctor. See, error is not criminal negligence, but this situation is coming up more and more in our day to day life. So, what should be our approach? See, the best thing is that whenever we are doing a procedure, it is high time that we explain to the patient about smallest complication and obtain and consent, which should be ideally recorded. Because nowadays, if you are not in a position to properly explain the patient, then every complication is going to create a big stress for you. That is number one. Number two, when there is some surgical complication or some complication which is unexpected, it is better to involve our another colleague who has equal or a senior expertise and tackle the situation jointly. Number three, never leave the patient till end. That means either patient recovers out of it or whatever is the negative result. Because the most important thing that referring the patient elsewhere in a complicated state is going to create a problem because it has been observed that other colleague may make a loose comment or sometimes now here also the next issue which is coming is interpersonal relationship with our colleagues. You should not give the patient. I tell you, in my practice, whenever I have thrombolized the patient and patient has got intracerebral hemorrhage, from my hospital, I had to shift the patient to corporate hospital. I accompanied the patient. I remained in ICU for initial 4 to 6 hours. Explained to the patient that this is a known complication which occurs without any mistake of a doctor or any mistake of clinical judgment. So this is another situation where you should not leave the patient out. Whatever complication you are facing, you should be confident to explain to them that every complication is not negligence, every complication is not a mistake. So now it is high time that the senior colleagues who are practicing for more than 3 to 4 decades, they should write books about their experiences and guide the newer generation how to approach the patients who develop complications. Now, another, this may be little controversial, so I apologize if someone disagrees to me, but these are some of my observation that our society, when we are collecting our charges, when we are taking our fees, our society in general doesn't have a health budget in their planning. Whatever amount the earning they are doing, but in their budget planning, there is no plan like health budget. And so whenever a time comes to pay to doctor, either because of the circumstances they are not willing, or I have seen, I'm sorry to say, but I have seen many rich people bargaining with doctors. And have seen that the poor people, they simply request. They accept most of the things. So it's a paradoxical dilemma which we are facing in our practice. And so what I have been doing for last 10 to 15 years is to increase awareness about health insurance. Till in the society, I see about the 20 to 30 percentage of the patients do not have their health insurance. Now, of course, with the government machinery giving us various schemes, Ayushman Bharat, they are good. So, in turn, a patient who is insured or a patient who is beneficiary of government scheme, they are less stress as far as the fees and charges are concerned. But this is something very important issue which individually we have to plan out. What are your concept about your earning, your fees? You have to individually plan out, but you have to keep in mind this fact that primarily most of the patients are unprepared for paying the fees to the doctor. This is a reality. What should be the solution that can be discussed out on a larger scale? But this is the reality, and we should, from our side, we should increase the awareness about the health insurance. This is the most important thing. I think I should spend about 5 minutes talking on this topic, and it is the stress of competition in the medical profession. Friends, we are competing with each other, but I have realized what is the reason, because it is the fear of losing a patient, there is a sense of insecurity. I personally believe that medical profession is a profession of coexistence for all of us. And we have really done wrong things by making it a field of competition. I have my own means, because this may not be acceptable to all, but I have overcome this stress of competition by developing a particular approach. This, again, I am telling, it is my totally personal experience, and implementation may not be true for all of you, but I think it is a time to think. You may not have the same approach which I have developed. What I have done, that if a chronic patient, hypertensive patient, diabetic patient, asthmatic patient, who has been following a physician for 8, 10 years, comes to me, then I first question I ask to the patient is, why are you coming to me? This particular physician is treating you for 10 years. 60% of the patient will tell you that, sir, my doctor is out of station. That's why I have come to you. And in this situation, I tell that your treatment has been very properly given because he has been treating you for 10 years. Whatever current suggestion I am making it, the moment your physician comes back, go to your physician. This is what advice I give. And I have learned this aspect, that whenever I am going out for a particular few days or week, I have in my waiting room, I have informed to my patient that in my absence, you can contact this or this physician who is available. We don't realize that this thing is so beneficial that it improves the interpersonal relationship. We should feel that we all are one as a doctor community. If we want to make our profession stress free, the most important thing is to remain united and not to compete amongst ourselves. So this is how I have realized. And then second question, sometimes patient would say that, sir, previous doctor was good so far, but now I am not getting good result. Still, first thing I will tell them that you should go back to him, because he is knowing for 10 years. Looking at your face, he will know many things. So still, and if I feel that now the patient has lost faith, then only I accept the patient. And these things help me to maintain my patient for a fairly long duration. I have completed almost 35 years of my private practice, and I can tell you that almost 80% of my patients, diabetic, hypertensive, ISD patient, are following me for last more than 25 years. In spite of more and more physician cardiologists coming in the city, their faith has remained intact, because I remain open. I never pressurize or never try to catch up the patient. So this is the approach I have developed. This may be subject of discussion, and all may not accept to this approach. But then it is time to devise your own approach. That we have to anyhow make this profession a profession of coexistence and not competition, whatever you may do this. Another thing is, now it is an era of doing group practice, because unless and because one person working 24 by 7 is a bygone days. I remember in early days when I started my practice in 1991, I was the only person in my nursing home with 10 to 12 indoor patient, 2 to 3 patient critical, and was unable to leave out my nursing home 24 by 7. And during those days, no qualified nursing staff, medical officer. Nowadays, we don't have that situation. It is high time that we unite and form a group and work in a shift pattern, or in a pattern where we can have some off practice work. We will be discussing further what are the things which are required to remain fit and healthy in spite of such a stressful medical practice. Now, this is nowadays the Medical Litigation and Consumer Protection Act. is creating a big stress to all of us. Many of my friends, my colleagues have passed through this. And what I have realized that if you have these four E's, I call it as four E's. First is eligibility. See, many of the litigations where the complication have arisen in patient community, they have gone to court. They have found that doctor is not adequately qualified. See, in my center, before the DM cardiologist came, I was doing echo, even all the cardiac practice. The moment DM boys have started coming, gradually I have started shifting newer patients, because those patients who are following you for more than 2 decades, they would want everything from you. But the newer patient, I am shifting them to younger generation, because now I feel that the DM boys are more eligible than what I am. So whatever procedure, whatever you are doing, you have to think of your eligibility. You have to be efficient. If you are not confident, if you are doing some procedure early, don't venture the complicated procedure or treatment, and get enough exposure, be efficient, and then go ahead. Most important thing is ethics. I have realized that if you are ethical, if ethics is with you, in spite of other factors, I can, if time permits, I will share some of my experiences where I have made mistake, but because I was ethical, the patient has deferred. The daughter of the patient said that my mother was considering you son. We don't want to go to court because you have been so good and you have been looking after for more than a decade. So if you follow ethics, and how to define ethics, simple. Treat every patient sitting in front of you as your family member. Treat him, her, as your brother, sister, relative. Then whatever advice you will give will be ethical advice. No need to learn anything. Treat them. And here I tell my spiritual guru, I follow my Guru Sri Satya Sai Baba, who told me that each and every of your patient is your family member. So you will not do anything unethical who is your family member. And most important thing nowadays is e-practice. That means electronic practice, maintenance of record, and all of us have to shift to computerized practice. I'm sorry. Use latest softwares, use all the latest technology, and maintain proper records. I feel that if four E's are with you, eligibility, efficacy, ethics, and e-practice, I don't think you should worry about CP. By chance you face it, but on a long run, you will be the safe person. Now, another few things which are coming us amongst the doctors is techno-stress. Just before this slide, I told that we have to adapt the technology. But this technology is creating a techno stress to all of us. And the most important problem is the use of mobile in our day-to-day practice. See, every scientific innovation has two sides. As all our drugs may have some side effects, here also the use of internet, computer, and mobile is creating many health hazard and stress for all of us. I have analyzed many of my patients who are using, this is not for doctors, but the patients who are using mobile after 8 p.m. every day, they are suppressing their release of melatonin. The biological cycle, which is created by God, is disturbed. They get a poor quality sleep. Their sleep, when do they sleep? They don't know. 2 a.m., 3 a.m., because the mobile and social media is endless. You don't know how long you are going to suffer, and that increase the stress hormone in the morning. In due course of time to come, I am sure that the use of mobile till late night will be one of the important risk factor for ischemic heart disease. So I request you that you should use this technology, but you should know when to stop and you should know when not to use. You all are competent, so I don't think I should go into the details of this. Another problem is this is, remember, almost 15 years backside, I have ended COVID today while preparing the presentation, that we have been facing newer and newer epidemics. So much so that many of our doctor colleagues, I would talk about Congo Crimean, when my brilliant junior fellow, Dr. Chintanoza, who was intensivist, while working in ICU, contacted Congo Crimean and succumbed and lost his life at very young age. So I feel that we have to remain alert about the newer epidemics, and all this is possible only if you have time for yourself. Otherwise, you are not going to know all the newer things. So this comes to the most important aspect of all the doctors. We all are suffering from vitamin T deficiency, time deficiency. See, the problem is that we are so much into our medical practice that we don't have time for our personal social life, for our family, and for upgrading ourselves. All these three things are very, very important. So, therefore, it is up to us to manage our time. And to manage the time properly, you have to have a clear cut framework of your number of patients, your number of procedure. Because in initial days, when there were no many doctors, one doctor used to do everything. And so there was a pattern of working 24 by 7. I would request all my friends, the senior you become, start restricting your work. Whatever is the, say, if you ask me, I started with, because I had an intensivist training in Jaslo Hospital long back in 88. So when I started my practice, I had ICU, 3 beds as a single physician managing. In 5 years, I closed down ICU. In another 5 years, I closed down my indoor practice and I focused on eco treadmill. So it is my approach that you focus on a less stressful and more enjoyable work. So in span of 10 years, you would realize which is a less stressful and more enjoyable for you. You start focusing on that and start giving the stressful work out of your schedule, and this will help you to remain healthy for a very, very long time. You spend time with your family, spend time with your kids and your parents. I have seen that so many doctors are so busy, they give good education money but not company. I think because of the time, we will not, some, if time permits, we will have a session on everything. So here is a suggestion: you divide your work in every day 30 minutes, plan for your hobby, keep weekend off, and when you are with your family, a dedicated time to your kids. Remember, nowadays, when you are fasting, it is the fasting of mobile. Whenever you are with your kids, my granddaughter, if looks at mobile in my hand, Dadu, I will also take mobile. So this is the time when we are spending time with our kids. Mobile has to be away from us. This is very important, and you have to manage your time. You should find out your own way for managing. So, what is my suggestion? Divide your time into 3 parts. Professional activity should be not beyond 8 hours, and dedicate your time to family once a day or a week, and 30 minutes every day for your hobby. See, I tell you, I am so passionate about singing. I am working almost 8 to 10 hours a day in outdoor, and I sing every day 30 minutes. From morning till evening, 30 minutes I am spending for my hobby. So you should spend time for your hobby. And you, let me tell you, every doctor is gifted with some extra talent. Either writing, music, sports, whatever you enjoyed most in school during your college day, revive them. Start giving time to it, and I can tell you, you can be better than the professional, because we have made a group of doctors and we are regularly performing various shows. And last thing is social service. I feel that every doctor should do some social service, because ours is an era where we can kill two birds with one stone. Every day, I would request you, our spiritual Sanatan Dharma says that 10% of your work, your amount income should go for charity work. You find out the patient of your own and do charity work, although we are doing it, but it should be in a selfless way. So I think it has been times to think that our medical practice is so stressful. With all senior colleagues, those who listen to me, let us come on platform and devise one text about converting academics into practice. And I feel that every doctor should no medical science, social science, and spiritual science. I think the 30 minutes time is over. I think the things have been useful. If you have any question, discussion, I would like to answer.
Thank you, sir. Thank you so much. I must say that was a beautiful presentation. And sir,
Thank
the
you.
tips that you have given, that's not only applicable for the doctors, but it's for everyone, I guess. So everyone should
I
abide
actually
with.
deliver talk to all the society, various clubs, school, colleges. My fundamental is that we have to focus on three things: ahar, vihar, and vichar. Ahar means
Right.
our diet, vihar is exercise, and vichar is our mind. So if you follow all our Sanatan Sanskruti, this will give you all the guideline for managing this.
Right, right, sir. Truly said. And I'm very sure, other than doctors, many people have joined us and they all have been benefited by this session. Because we generally do topics which are related to medicine only. But this was a
Yes.
session which was related to doctors, but yes, it was for everyone, I guess. So thank you so much, sir. Let us see what are the questions that have come. Sir has already discussed this question. Still, sir, there is a question that, as per you, what is the most common source of stress? That's for the medical professionals, and how do they impact their decision making?
See, I have already discussed everything because there are every right from the symptom, investigation, treatment, everything. See, what I would answer in only one question, that if your by heart your approach is noble, then any situation will not create any stress. So I personally believe that the medical science should be taken away from the commerce. We should not worry about the charges, and we should focus only on the science and approaching the developing the spiritual attitude. See, because of the lack of the time, I have not covered many aspects. But those who see spiritual things, our Sanatan Dharma has given us all the guidelines. Only thing we have to apply them. See, I all may not agree, but whatever amount of money you earn today has nothing to do with what hard work you do today. That is what spiritual science says. That your previous karma has designed a luck, and that luck has delivered you the amount of money which you have earned today. It has nothing to do with number of procedures of number of patients you have seen. That's why we see many people get lakhs of rupees just in one script of the share. This is luck. So, but how you are working today will decide how what you will get tomorrow. So you should never target your day with amount of money or what you will get. Our science, our spirituality says that whatever you have, try to give it to the society, and this approach will make everything stress free. I still I work actively, but then as I said that we should do social work. Very recently, I had a young girl, 28 years old girl, who had both the lungs damaged, severe cold pulmonary, and very strong girl, but very severe terminal disease. So I requested all my friends, many of our doctors, and we raised the fund for her, and she underwent successful heart lung transplantation. And you see, this gives you tremendous satisfaction. That's why I told you that when you have a base of service, then no amount of stress will affect you. Otherwise, in all my discussion today, I have discussed what are the stresses in your OPD, in your OT, in your ICU. I have discussed all those things in detail.
Right, so very nice thought. And yes, charity that keeps our mind relaxed and only thinking about money that gives more stress to everyone.
Exactly.
That's going on to the next question. Sir, what role does emotional intelligence play in helping medical practitioners navigate stressful situation, and how can it be cultivated?
I think this is the question which I have faced as an individual, being an emotional person. See, whenever the patient comes to me, I find that patient is in agony, patient doesn't have money. I used to get so much upset, and this emotional stress was affecting my health. There are two things which we must keep in mind. Most of the time, a patient who is in agony, We feel emotional stress because the patient is not in a position to pay. That's the biggest problem. And all the emotional doctors, I have discussed with many of my friends, they feel unhappy that this guy has come to me with this illness, but he is not in a position to pay. So, what to do? See, our approach should be what I do, that whenever any patient comes to me, I feel I give them options. There are many diagnostic centers which offer the investigation at a subsidized rate on a trust base 30%, 40%. So, I ask the patient that, see, you need this many investigation. Where you want to get it done? I have my own laboratory. I have got all my equipments, but I will give him option. And once this patient says, "Sir, it will be good if I go there." So at end of the day, almost 30% of my patient they go to the trust. They come with that report. So now this emotional irritation, which is creating a good doctor, many of you can be eliminated by giving them option. And as far as the result is concerned, one thing is clear that every result is decided by the karma of the patient and doctor. So it is destined. No one can say that I have saved the patient. In my clinical practice, patient coming with cardiogenic shock, cardiac arrest, revived and they have come out. I cannot say that I have saved the life of the patient because it was his lifespan which was destined and I became simply an instrument. If I claim that I have saved the life of this patient, then in ICU under my treatment, two patients died. So would I say that I have killed the patient? So you have to have a balanced approach to the result, and emotionally we have to control ourselves by empathetic approach. Empathetic approach is very helpful to me, and it has helped me to develop a large number of patients. I have got three generations of patients coming to me. I have a patient, a young girl who had VSD, came to me as a pediatrician. She got married, her in-laws come to me, and now her children, third generation, they are coming to me. I feel that we have to have a very social background. This profession is not that of money. And believe me, money is a byproduct of this profession. Those who genuinely stick to this fundamental, money definitely comes. I cannot come, I never think of income of other doctors, but I have got everything. So, what more you need, you get everything, you can live the way you live. So, primarily, most important issue is a financial issue which is creating problem in present era. So, we find out various solutions. Certain NGOs, wherever you feel, don't think that every patient who has entered to your chamber has to pay. That's the first thing we have to keep in mind. If we start developing the system, one thing at this stage I would like to draw to your attention that suppose at the middle of the night a person is passing by and he develops heart attack and he lands up in a nearby hospital. He has no money in his pocket. So now what should be our approach? We will say that deposit 1 lakh rupees and then we will start the treatment. That is what routinely is being done. But we have a group of doctors, and the corporate hospital where we are attached, we have devised a system where we have kept fund of 5 lakhs rupees reserved in the hospital. And any of our patient who reaches at the middle of the night, we take the responsibility that patient should be treated, should not be asked for the deposit, and by chance patient dies in 6 to 12 hours, you should hand over the dead body to the relatives and request them that, see, we have done our best, we could not save the patient, you may come later and pay the bill. We have done this thing, and believe me, 80% of the patients have come back and paid the fees. 20% who do not come, you reimburse from the fund which you have kept reserved, because this is high time. Now society is very revengeful. One such incident where you don't treat the patient without depositing the amount, or you don't hand over dead body without completing the bill, is now creating. You see, all the violence, the destruction is more damaging than one bill. So it is high time that the profession has to see. Even in America, which is totally privatized sector, no one can refuse the treatment to patient who is presented in emergency. And I have some of my patients who had gone to USA, had sudden some acute emergency. They landed up in a hospital. They said, I have no money. He was treated. While he said, I have no money. They had to let him go. So it is better that we understand, and this you will realize. See, how did we get this idea of making a separate fund in every hospital? My own uncle, at the middle of the night, had a CV stroke, and I was working with the hospital. In very same hospital at 12:30, I drove my car and took my uncle in the hospital, and we were planning to thrombolize, and CT scan was to be done. The person in the CT scan told me that you deposit 10,000 rupees and then come for CT scan. I, being doctor, took my uncle to the hospital, and then I realized that this feeling, if you pass through this stage, then only you can understand what should be done. So there are some ways and out. You can definitely keep a budget through NGOs, by various sources, so that in such circumstances, such situations are going to arise only in 5 to 10% of the patient. So you keep a separate reserve fund in hospital where patient comes without money. And yes, suppose after 12 to 14 hours patient is stabilized, then you have to tell them that, see, now you have to be prepared for the charges. And if you don't think that you can afford the charges here, then we have managed ambulance. We can shift to you to trust hospital or another hospital. I am not telling that you do charity throughout the course of the illness or till you discharge the patient, but it's the mainly critical 12 to 24 hours when the patient is critical or patient dies. So it is high time that we plan out every step we revise. So I feel that it is the time to restructure the medical profession as a whole, right from education. Whatever symptomatic dilemma I told, it is arising because younger generation is deprived of clinical teaching, because the newer examination, the NEET preparation, they all have to answer MCQs. So talking to patient, finding the clinical science is gone. So that is again creating a stress to society and to the patient. So it is a high time that the seniors of this profession, they come together, they make a platform and restructure the medical education and medical profession right from step one. Because partly our entire system is driven through the Britishers who left and then some modification. It is right time to reorganize and restructure the medical education and medical practice.
Right, sir. Coming to my last question for today, that is, sir, that there are a lot of corporate hospitals who put stress on the doctors, like they need to do these investigations and they need to do this prescribe this kind of medication. So that also puts a lot of stress to the doctors. So what should such hospitals do, or such healthcare institutions do, so that the doctors they can
Now,
overcome this kind of stress?
Now, there are two aspects. What can a hospital do and what should a doctor do? I will answer what a doctor should do. See, because the very first step, because all young coming doctors are going to corporate because they don't find the options. So, first and foremost thing, in our medical teaching, the ethics has to be taught in right from first MBBS onwards with some spiritual background, so that the conscience of the doctor doesn't permit doing this. But we have no such formal training. That is number one. Those youngsters who are going to the corporate, we should remain firm that I will ask only for those investigations, those procedures which are genuinely indicated. And we have to give confidence to the young generation. And that is what I told, that in a city there are two senior cardiologists who are so busy, they should take him as their junior colleague and not let them surrender to corporate hospital. But Indian Medical Association as a whole, the teaching in the youngsters and medical community unitedly, when they said that whatever corporate hospital asks for this, no young doctor would join the hospital, where will they go? A time will come that they will have to go down. And what a corporate hospital can do, government laws can definitely enforce that. That You should not pressurize your young doctors for a target because it is a target based approach. I know many of juniors who come to me, they meet me. I have told them that you resign this job, you have faith in God, you will have something better, but don't surrender to this kind of. It's difficult because one is starting the career and it is difficult to stick to principle. But I think if we are taught the values right from childhood, no doctor will do this, and it is high time again because the corporates, those who know the incidents of Kathy Hospital in Gujarat, which occurred last month, is a really eye opener for all of us. That a corporate hospital doing camp in village, a patient having backache and doing angiography and so many irregularities. I think no doctor should accept this, and we should teach our young generation the ethics at every step of medical education. Then I think this can be, these are all problems of moralities and values. And I think this has to be done with a long term planning starting from day one.
Right, sir. And what I feel is that the doctors should stand unitedly. One is doing it, and another one is, yeah. So
True.
if
See,
everyone
that is
tells,
what when I discussed, I said that it is not a competition. It is
right,
medical profession is profession of coexistence. We have to remain united. If one person refuses doing wrong thing, others should also refuse. So that is you have rightly mentioned that the unity amongst the doctor is the most important thing to make the practice stress free. That is absolutely right.
right, sir. Sir, we have received some beautiful comments from our viewers. Let me show you one by one. Yeah, Mr. Teli has written such an important topic for all doctors. Thanks, MedTalks. Thank you so much, sir. Another one, yes, sir, 100% right. So they agree with you. Then excellent presentation and suggestions. Thank you so much, all. Thank you all for participating in this session. And sir, special thanks to you for like putting such an important topic, which generally is not discussed everywhere. And sir, for giving us your expertise and the practical advices that you have provided were really very beneficial for all. So thank you, sir. Thank you once again. And thanks to everyone for joining in, for your comments, for your questions. Thank you. Thank you, sir, once again, sir.